will be on inflammatory bowel disease. This is inflammatory cell infiltration of the bowel, and it may involve eosinophils or lymphocytes and plasmacytes, or basophils, granulomas. Often leads to diarrhea if the large colon is affected, and low proteins if the small intestine is affected. Okay, so while you're thinking about things that might cause an inflammatory or an infiltrative bowel disease, what would be another differential in a 20-year-old horse? All signalements can be affected. There may be dietary allergens involved in some of these, but that's been a recent update. And clinical signs are progressive weight loss, poor appetite, diarrhea if the colon is affected, peripheral edema and anemia from the low protein, as well as hyperproteinemia, anemia of chronic disease, and dermatitis, so the poor doing. So if you have a horse that has dermatitis, low protein, ventral edema like this guy in the pectoral region, it's a good thing to start looking for inflammatory bowel disease. Best diagnostics are intestinal biopsies that may be taken laparoscopically or through the endoscope in some cases, and rectal biopsies. So even if the small intestine is affected, there often are changes in the rectum that would go along with it and help lead to a diagnosis. And this one you can see a bunch of inflammatory cells in the crypt area. Ultrasound's a little less invasive way to do it. The horse on the left has a thickened small intestinal wall that's more hyperechoic. The ones on the right have very hypoechoic walls. So this may be due to the inflammatory cell infiltrate, or the two on the right may well be due to the hypoproteinemia and edema due to the lack of colloid osmotic pressure in the wall. So again, with a horse with ventral edema, you might see the ultrasounds on the right versus the one on the left, or you could see all three, and the furthest one to the left is actually the lesion. The other three images are just low protein. Another way to detect this disorder is through a glucose or D-xylose absorption test. And we know that if we give glucose or xylose into the stomach, that it gets absorbed in the proximal small intestine. And then we can measure it in urine and blood. So if it's not being absorbed, so if they had these infiltrative bowel diseases, they're not going to absorb it as well, then we can detect problems. And recently they found one stallion that had high levels of gluten-dependent antibodies, using the same sort of antibodies they used to detect this in people. And after 6 months on a gluten-free diet, he was doing better. So you'll probably see more of this in the future. Complications, unfortunately, are often fatal. And the prognosis is usually poor unless it's resectable, as these horses just can't survive without being able to absorb nutrients. Treatment is basically referring to confirm the diagnosis, so you're not putting down a horse for something treatable. If the owners do want to treat, you need very aggressive treatment, and it often doesn't work that well. So nutrition or diet changes. As I said, they did try the low gluten diet in this horse. It took about 6 months, but he did recover. Steroids, you have to be careful with the horses because of the risk of laminitis. And then metronidazole to decrease any bacterial infections, and hydroxyurea to help with the intestinal wall. If you have a focal lesion such as this horse had colic signs because the small intestine was backed up proximal to this annular ring infiltration that could be removed. So if you can remove it, better prognosis. Otherwise, these guys just don't do well. There is no known preventative measures in place at this time. Unfortunately, this is one of those bad diseases.